What's up, YouTube watchers? If you don't know what multiple sclerosis is, we're going to watch a video from the Mayo Clinic telling all about it. Let's get into it.
I'm Dr. Oliver Tobin, a neurologist specializing in multiple sclerosis at Mayo Clinic. In this video, we'll be covering the basics of multiple sclerosis. What is it? Who gets it? The symptoms, diagnosis, and treatment. Whether you're looking for answers about your own health or that of someone you love, we're here to provide you with the best information available. Multiple sclerosis is a disorder in which the body's immune system attacks the protective covering of the nerve cells in the brain, optic nerve, and spinal cord, called the myelin sheath. And this sheath is often compared to the insulation on an electrical wire. When that covering is damaged, it exposes the actual nerve fiber, which can slow or block the signals being transmitted within it. The nerve fibers themselves might also be damaged. The body can repair damage to the myelin sheath, but it's not perfect. The resulting damage leaves lesions or scars, and this is where the name comes from: multiple sclerosis, multiple scars. Now, everyone loses brain cells and spinal cord cells as they get older, but if part of the brain or spinal cord has been damaged by MS, the nerve cells in that area will die off faster than the areas around it that are normal. This happens very slowly, usually over decades, and typically shows up as gradual walking difficulty happening over several years.
Yep.
When you read about multiple sclerosis, you may hear about different types. The most
Have the relapsing remitting type.
frequent being relapsing remitting multiple sclerosis, and this is characterized by attacks or relapses. We don't know what causes MS, but there are certain factors that may increase the risk or trigger its onset. So while MS can occur at any age, it mostly makes its first appearance in people between the ages of 20 and 40.
I was 34.
Low levels of vitamin D and low exposure to sunlight, which enables our body to make vitamin D, are associated with an increased risk of developing MS.
I have to take vitamin D and K2 pills.
And people who have MS, who have low vitamin D, tend to have more severe disease. So people who are overweight are more likely to develop MS, and people who have MS and are overweight tend to have more severe disease and a faster onset of progression. People who have MS and who smoke tend to have more relapses, worse progressive disease, and worse cognitive symptoms. Women are up to 3 times as likely as men to have relapsing remitting MS. The risk for MS in the general population is about 0.5%. If a parent or sibling has it, your risk is about twice that, or about 1%. Certain infections are also important. A variety of viruses have been linked to MS, including Epstein-Barr virus, which causes mono. Northern and southern latitudes have a higher prevalence, including Canada, the northern US, New Zealand, southeastern Australia, and Europe. White people, especially of Northern European descent, are at the highest risk. People of Asian, African, and Native American ancestry have the lowest risk. A slightly increased risk is seen if a patient already has autoimmune thyroid disease, pernicious anemia, psoriasis, type 1 diabetes, or inflammatory bowel disease.
Honestly, I do have inflammatory bowel disease. It's kind of embarrassing, but just thought I'd let you know.
Symptoms of a relapse usually come on over 24 to 48 hours, last for a few days to a few weeks, and then improve in the region of 80 to 100%. Those symptoms include loss of vision in an eye, loss of power in an arm or leg, or a rising sense of numbness in the legs. Other common symptoms associated with MS include spasms, fatigue, depression, incontinence issues, sexual dysfunction, and walking difficulties.
I have walking difficulties, especially
There's
my
currently no
hip
single test
replacement.
to make a diagnosis of MS. However, there are 4 key features which help to secure the diagnosis. Firstly, are there typical symptoms of multiple sclerosis? Again, those are loss of vision in an eye, loss of power in an arm or leg, or
When I first had the symptoms, I was losing my vision. It was just going black. That's all I could see. And it was very scary.
sensory disturbance in an arm or leg lasting for more than 24 hours. Secondly, do you have any physical examination findings consistent with MS? Next is the MRI of your brain or spine consistent with MS.
Yeah.
Now, here it's important to note that 95% of people over the age of 40 have an abnormal brain MRI, just the same as many of us have wrinkles on our skin. Lastly, are the results of the spinal fluid analysis consistent with MS?
That's what I had to get, a spinal tap. That was the last thing they did. And then after they did that, they told me I had multiple sclerosis. I didn't even know what it was, never heard of it. So I had to do my research on it, and I found out.
Your doctor may recommend blood tests to check for other diseases that share the same symptoms. They may also recommend an OCT test, or optical coherence tomography. This is a short scan of the thickness of the layers at the back of your eye. So the best thing to do when living with MS is to find a trusted interdisciplinary medical team that can help you monitor and manage your health. Having a multidisciplinary team is essential for addressing the individual symptoms that you are experiencing. If you have an MS attack or relapse, your doctor may prescribe you corticosteroids to reduce or improve your symptoms. And if your attack symptoms do not respond to
That's all they can do when you have a relapse. Is give you steroids. And as you know, if you've watched my videos before, steroids cause a perforated ulcer in my stomach, and they had to cut me wide open and patch it up. It also caused to have a vascular necrosis in my leg, in my hip, and they had to give me a hip replacement. And that hip replacement, I had to have 3 of them. Finally, I got one in that worked.
steroids, another option is plasmapheresis or plasma exchange, which is a treatment similar to dialysis. About 50% of people who do not respond to steroids have a significant improvement with a short course of plasma exchange. There are over 20 medications currently approved for prevention of MS attacks and prevention of new MRI lesions.
I take Tecfidera 2 times a day.
And learning to function with MS can be challenging. There are medical experts ready to work with you to help you manage it so you can still live a full life. Consulting with a physiatrist, physical or occupational therapist can help you deal with physical difficulties. Physical activity is strongly recommended for all people with MS. Mental health is also an important consideration, so keeping up personal connections with friends and family and trying to stay involved with your hobbies is important. But also be kind to yourself and realistic about what you're up for. This can change from day to day, so it's okay to give yourself permission if something seems like too much or if you need to cancel plans. You may also find support groups helpful to connect with people who understand what you're going through and discuss your feelings and concerns with a doctor or counselor. Meanwhile, scientists are hard at work expanding our understanding of this disease and developing new treatments and medications which are ever more effective. If you want
I personally think that they have a cure. I really do. I think big pharma has something to do with it. But like I said, I don't before in a video, I don't want to get into conspiracy theories or anything like that. But I think they got the cure for it.
want to learn more, watch more of our videos or visit mayoclinic.org. We wish you well.
Go subscribe to Mayo Clinic. Guys, I'm sorry about all the slurring. I know probably you can't understand what I'm saying half the time, but it's just the way it is. And you could tell how my face is kind of drooping down. So I just wanted to get, multiple sclerosis awareness out and what all it can do and how it can progress in your life and what it does. So thank you for watching. My videos are about multiple sclerosis. That's all I talk about. That's all I talk about. So if you want to learn more about it, keep watching my videos. And please like and subscribe. Thank you.